Hey guys, so I wanted to take some time today to explain what a dilator is. I get a lot of clients who come in with vaginal pain, vaginal discomfort, sexual dysfunctions that are really centered around some pain in the vulva area. And one of the ways that we work on that is through dilator exercises. So whenever I mention dilators, sometimes we get blank stares or I don't know what that is, and so I wanted to take a quick video and explain what a dilator is. I have the Pure Romance set dilators. You can order different kinds of dilators. Usually they come in a plastic form or they can come in a silicone form. What I have heard review-wise is that people prefer the silicone one because it feels more lifelike. It's more comfortable versus a plastic tube. So I want to show you this dilator set. Here's kind of what it looks like right here. And they're very colorful, which I think can make the experience a little bit more playful and fun. So usually a dilator starts out pretty small. So this would be your smallest size that you would use. Sometimes this isn't big enough or small enough, and so you might go down to something like a Q-tip. Usually this is pretty accurate for a pinky, but if this is too big, then you would use something smaller like a Q-tip. What happens with dilators is that you would use these for, the reason why you would use a dilator is if you're having something like vaginismus, which is spasms in the muscle of the pelvic floor around the vaginal area, so it feels impossible or difficult to have intercourse. If there is dyspareunia where intercourse is painful, or there's some atrophy going on, some dryness from postpartum, menopause, after chemo, different areas that would cause pain or create pain in the vaginal area could be helpful to help relax the muscle with a dilator. When we recommend dilators, it's really great to try and seek guidance from a pelvic floor therapist. Usually what happens is or like a sex therapist, a therapist, a gynecologist, OB, they would typically recommend a pelvic floor therapist, and then the pelvic floor therapist would be able to more accurately describe what kind of exercises they feel like would be necessary for you in terms of using dilators. Though you don't need a pelvic floor therapist, it's really helpful because you can have more guidance toward your specific area needing work. So when using a dilator, what you want to do is have a lot of lubrication, typically water-based because it stays on longer, which is nice, and it reduces your chances of getting an infection. You want to start out with something that feels comfortable. So say you're starting out with the smallest size. You want to create an atmosphere that's relaxing. So something that's pretty typical is laying on your bed, turning on a relaxing TV show, and then inserting the dilator to a point that it feels comfortable. Say this is an accurate size for you. You would slowly insert it. You would have your legs out in a butterfly position, so your legs would almost look like a diamond shape. Your feet are together, your legs are making a diamond so that your pelvic floor is more open. You're laying on your back. You insert the dilator and then you do some deep breathing. You can do some deep breathing as it goes in, but really trying to get the pelvic floor to relax as you insert the dilator. Watching something like TV can help get your mind off of it because there's typically a lot of anxiety that goes around vaginismus or vulvodynia, dyspareunia, some kind of vaginal or vulvar pain. Having something on to distract the mind can help in the relaxation process. Once you have something that feels comfortable in, so say it's this size, you'll then want to take the one that you're using out and then slowly insert the next size. You want to spend a good 5 to 10 minutes on each doing some deep breathing relaxation as the dilator is inserted. What you don't want is you don't want to force it to the point that it's uncomfortable. So say you're in this size and this feels too big. What you want to do is maybe you'll have the tip in and you will do some deep breathing and then slowly start inserting it a little bit more as the time goes on. So doing some deep breaths, making sure there's a lot of lubrication on there, and then slowly inching your way so that the dilator starts to increase in length into the vaginal canal. The sizes range, so it goes all the way to this guy, from this guy to what I call Big Bertha. I think I call it Big Bertha because I used to golf a lot, and my biggest club was called Big Bertha, if you're a golfer. But there are definitely a variety of sizes that you would use for your dilator exercises. So the goal is to be able to have muscle relaxation so that intercourse is painless, not experiencing pain during sexual intimacy, during intercourse. So allowing your partner to be a part of this can actually be really fun and playful, because what I hear many times is I feel like I'm doing these by myself, and it feels like I have to go off do my exercises for us to be able to have successful intercourse. I say if you feel comfortable involving your partner in that experience, it can be really fun. And what can happen is you can use it as a way of foreplay into then insertion for your partner's penis whenever you guys decide to, whenever it feels comfortable to then move into intercourse. It can be a fun and playful way to move in intercourse that your partner can be a part of. But initially, depending on your anxiety level, it can be nice to just practice on your own and figure out what your level of comfort is as you're transitioning into intercourse. So those are just some quick tips. You can also check out a sex medicine doctor who more accurately diagnose what you are going through in terms of the sexual pain or sexual discomfort that you're having. That's a quick recap of dilators. If you have any questions, just let me know.